So good morning, everybody. Happy snow day. If you watch on, if you go to Women 10 Facebook, you're going to see that I tried out my tube on Blueberry Hill on the weekend with my two grandchildren, and we just had a blast. It was so much fun. Okay, so here we go. This morning we have Leah Currie. She's going to be doing the presentation this morning. She is a Master of Social Work student, and she's working with Taylor Matson, who is a community health promoter with our health unit here in North Bay. So the topic is opportunities to access care for older adults at the health unit. And I was thinking, you know, turn up your curiosity value and you know, say, did you know? Did you know that? And I'm hoping we're going to get a nice overview of all the services our wonderful health unit offers us. So you're on, Leah, whenever you want to share screen, and I'll ask everybody else to mute except for Leah.
Okay, let me just set this up here. Let's see. Okay, can everybody see that?
It's black for me.
It's black for me.
Okay, just give me one sec. Let's see. Stop here. What about now?
It's your email.
Oh, is it the
Just
PowerPoint?
minimize the email.
Okay. Let's see. Yeah. Let's do this. Maybe this will work better. Can you see the PowerPoint kind of loading up?
Yes.
Okay. Good sign. What about now?
Yep, looks good.
Oh,
Looking good.
Okay, great. Yes, so as Harriet was saying, my name is Leah Jane Currie, and I'm a registered social worker, and I'm completing my Master's of Social Work right now, and my placement is with the North Bay Health Unit. So I'd like to start today with a land acknowledgement. We would like to begin by acknowledging that we are hosting today's presentation on land that has been inhabited by Indigenous peoples since time immemorial. The North Bay Parry Sound District Health Unit sits on the traditional territory of the Anishinaabe peoples and within the lands protected by the Robinson-Huron Treaty of 1850. Today, we are located on the shared territory of the Nipissing, the Doki's, the Algonquin Nation, and the historic homelands of the Métis. As individuals and as organizations, we are dedicated to honoring Indigenous history and culture and committed to moving forward in spirit of reconciliation and respect with all First Nations, Métis, and Inuit people. So I'm very happy that we're all joining today, and welcome. So what are we talking about today? I'll be sharing some information about services that are offered at the health unit for older adults, and I'll be talking about how to connect with these programs, and I'll be doing an overview of our Stay on the Feet strategy as well. Just to let you know, I'm not an expert exactly on these programs. I'm not a nurse or a health promoter, but I can talk about them and guide people to knowing what is available with the health unit and who to contact if you want more information. So let's start with the vaccine program. With the health unit, we do education for vaccines, and we also do administration of the vaccines. The first one I want to talk about is the Shingrix vaccine. This vaccine is typically publicly funded, so free, from age 65 to 70. However, due to COVID, it's been temporarily extended to those born from 1949 to 1952 until this December coming up. And if anybody wants me to go back to these slides at the end of the presentation, just let me know and I can do that.
You know, that is a did you know? Did everybody know that?
Oh,
I didn't know that. Wow.
there you go. Okay.
I didn't know that either, and I paid, I think, close to $200 for my shingles vaccine recently.
Oh, okay, well, yeah, so you can come kind of talk to the health unit and yeah, I mean, try to avoid, paying for these if you don't have to. Oh yeah.
I just have a question. It's Jill speaking.
Hi, Jane.
I see the ages are just 65 to 70.
Mhm.
And that I'm not sure how old you are, Patty. I don't know if all of us would fit into that age.
I would have qualified. Yes.
Okay. But I know like some of us would not have, and I think maybe that's why some people have paid.
Oh,
you know.
okay.
Yeah.
That would make sense, Jill. Thank you. Yeah. I don't know. Maybe we'll have to make sure that that's correct too. But this is the information we have right now, currently. So.
Hi, it's Dory. I just wanted to say I got mine free through my medical provider, my doctor. I didn't get it at a pharmacy. I got it through my doctor and it was free.
Okay, there we go. Okay, so I don't know, maybe we can talk more about these vaccines and the program after the presentation if people want to coordinate what people have done and what worked for them. Okay, all right. So the next one I want to talk about is the pneumovax vaccine. So this is for 65 plus, recommended to receive 1 dose of this vaccine. People with certain health conditions may be eligible for a second dose 5 years later. And the next one is the tetanus, diphtheria, and pertussis vaccine. So this is recommended every 10 years. If a dose of Tdap combination vaccine has already been given over the age of 18, clients receive the TD. And of course, we do have the COVID-19 and flu clinics. So during flu season, we have these community hubs. Maybe you've been to one before. So North Bay, like we have the Elks Lodge in North Bay. Sundridge has the SSJ Arena. Parry Sound has the Parry Sound Mall, and so forth. So, if you're in the district, chances are you are close to one of these places during flu season to get a flu shot or a COVID-19 vaccine. Also during flu season, we offer additional flu clinics in-house at the health units in Parry Sound and North Bay on select days. So the high dose influenza vaccine is recommended for those 65 plus to provide better protection. And next, we're going to talk about oral health. This program, the Ontario Seniors Dental Care Program, is designed to assist lower income adults, older adults in the community to cover dental costs. Coverage includes, things like checkups, scaling, polishing, but also x-rays, oral surgery, repairing broken teeth. There's also a partial coverage for dentures with a co-payment of $80. So it's a pretty good program, but there is an eligibility for it. I'll go through that. So this is how the program works. Folks can apply online. You can go onto the Ontario website, government website, and fill out an application there. But we also have applications available here, and you can kind of, come by and pick them up in person. I believe that we're able to drop them off as well, if you'd like one. So the ministry will process the applications, and then they determine the eligibility for the program. So it's not us, but we can assist in filling out the application if applicants need assistance. Once an application is approved, you'll get mailed an information package with a card, and it basically prompts you to give us a call, Health Unit, for further direction on booking and where you are in the wait list. And it's part of the program is if you already have a dentist, you wouldn't be able to access that dentist for this program. You would do your dental work through the Health Unit with that card that you would receive in the mail. And approval can take 4 to 6 weeks. And I'll just go through the eligibility criteria for this program. So there's an income eligibility, an age eligibility, an Ontario resident eligibility, and folks who have no other form of dental benefits. So including private insurance or dental coverage under another government program such as Ontario Works, Ontario Disability Support Program, or non-insured health benefits. So if you know someone that, or yourself, that might meet this criteria, it might be a good thing to look into. And this is our sexual health slide here. So we do have services, and it kind of includes people throughout the lifespan. So yes, so oops. Anyway, so the sexual health program, we have HIV, bloodborne infection testing, STI testing, education, PAP testing, which is recommended every 3 years until age 70. STI treatments are available, and it's a safe space. So, we're not judgmental. LGBTQ2S+ aware and empowering. So free condoms, dental dams provided. And we also do referrals for people who are looking to transition or want more information on the transition process. We can connect people to those services. And we also have this clinical information department. So if you kind of come in and you have general questions, you've already come in for an appointment and you have some side questions related to harm reduction or safer drug use supply, then this department can help with that. And this is the contact information for these programs. So we have the Health Unit website right there, but also our phone number 705-474-1400, and these specific extensions for the various programs right here. But I can come back to this slide if anyone wants to have more time with it. Although I believe, Harriet, you are recording, so we'll also have it on Facebook. Okay, and I forgot to mention that Taylor is monitoring the chat in case you have quick questions, or if you're responding to some of the questions I have. If you're not doing it verbally, then you can also chat.
Yeah.
Okay, so we're gonna start talking about stay on your feet, the stay on your feet strategy. And we're gonna do something a little different right here. I would like to take a bit of a stretch break.
Okay, ready?
Okay, so if you are comfortable to do so, please stand up, take a moment, and you can do some calf raises if you choose, or you can do some roll shoulders, like kind of go backwards, go forwards at your own pace. You can also do some arm stretches. You could also march on the spot. Basically, it's choose your own little adventure right here. So do your own thing, just to get up, just get the blood flowing. I notice when I'm doing calf raises, my left side's a little bit more, I don't know, I can feel it shake a little bit more. So that must mean something. So if you have to steady yourself with your hands on a table or at back of a chair, then go ahead. Just get some movement. Yeah. Harriet, I feel like you kind of went through this when I first came on to this morning, eh?
Yeah, we were doing our sitting down just for fun.
Yeah. And yeah, feel free, during this presentation, if you feel you want to move around a little bit, or if you want to stand, then that's totally cool. I would like to normalize, reducing the amount of time that we're sitting.
Yeah,
Okay.
feels good.
Okay. So stand or dance or whatever you want to do. All right. I'd like to just ask, have you ever had a fall? Feel free to,
Hands up.
yeah. Okay.
Fell in my driveway 2 days ago on the ice. Wow, that did not feel good.
Oh, okay.
I'm okay though.
So quite a few people actually, had some falls here. Okay.
I broke my ankle that way, Patty. It's many years ago now, but yeah, that ice is no joke.
Oh no. Okay.
Well, especially since you have that little layer of soft snow on top of the ice and you don't see the ice. So getting out of your vehicle, I would suggest, like, even if you get gassing up your car or whatever, like, be careful, because both my feet went boom.
Yeah. It's so easy for that to happen. Okay, so obviously you've kind of identified some of the ways that falls impact us, but so why should we worry about falls? Here are a few stats about falls in the older adult population. It's important to note that 1/3 of all people over the age of 65 have a fall each year, many of which result in hospitalization or a serious injury. While the risk of falling increases with age, there are certain steps you can take to prevent a fall and potential injuries associated with the fall. Is anyone surprised by these numbers or not really? No?
This group is pretty active for walking
Yeah.
mostly, but
You know-
I'm not surprised because it does happen.
Yeah. Okay. Another question. Where do you think most falls occur?
Oh,
At home.
Debbie guesses at home. Okay. Anyone else think something else, or at home, or what?
driveway.
Driveway. Yeah. Please don't say during a falls prevention PowerPoint, okay? Okay, so yeah, Debbie, you're right. I don't have a prize. I'm so sorry. Maybe we could work on that. But yes, yeah. So for fall-related hospitalizations in people aged 65 and older in Canada, household residence was identified by 52% respondents as the place where their fall occurred. So this data is from a surveillance report from the Public Health Agency of Canada. Actually, right now, North Bay Parry Sound District Health Unit, we're kind of working towards getting our own data right now to understand, falls in our community too. So hopefully I'll be part of that, because I think, each area does have unique challenges and we need to understand those. But as we can see, there's residential care facility, school, street and highway. I really thought street and highway would be more, to be honest. So risk factors for falls. What does everybody think? A risk factor for falls?
Sedentary lifestyle.
Uh-huh.
Lack of balance. Poor shoes.
Oh, I thought you said horseshoes for a second.
Poor
Horseshoes.
horseshoe.
Poor
I
shoes.
would think age has something to do with it, perhaps, aging,
Yeah,
like, and with osteoporosis, that kind of thing, maybe?
yeah. Patty, you know.
Mm.
Okay, so yes, there are
Muscle
a
weakness.
ton of risk factors, a ton. So I'm just gonna click through some of these. Some of these you all mentioned. Horseshoes, poor shoes. Yeah. Osteoporosis right there, right? So we can see that in the last one here, fear of falling. There are a lot of risks for falling. I think right now there's identified 150 different risks for falling. So chronic diseases like Patty, you mentioned osteoporosis, arthritis, diabetes, heart disease, Parkinson's, poor nutrition. So sometimes there's challenges with regulating thirst and eating as well, and medications can kind of impact that as well. There's physical hazards, so mobility aids in hallways, laundry baskets, clutter in rooms. Does anyone have a dog or a cat? Like, I mean, sometimes they get in the way too, especially if their bed is kind of in a walkway area, or your dog likes to sunbathe or something right in the middle of the room. That can be a challenge as well. So there are many consequences to falling right here, or the risk factors, sorry. So this is a fall cycle. So there's a fall. And then a fear of falling can create a vicious cycle that stops you from doing activities that you are able to do. A fear of falling may lead an individual to be less active, which decreases their muscle strength and balance, which someone identified there. And this ultimately increases their risk for falling, and eventually they may suffer a fall. After a fall, the person may be afraid of falling and become more inactive as the cycle continues. Interestingly, half the people who are afraid of falling have never had a fall. So it's important that we're aware of our own attitudes and concerns about falling, and consider that. So that's the fall cycle right there. But yeah, there are many consequences of a fall, as you know, as you're aware. Like pain and increased fear of falling are true of them, but one, maybe perhaps the main concern is a loss of independence. And I have a number fact here. It says Ontario's annual cost for falls and seniors has been estimated at $962 million. It's just, I don't know, it's mind-boggling. But in response to these consequences of falling, we do have this strategy. So the Stay on Your Feet strategy can equip you with the knowledge and tools to stay active and independent. It is a regional strategy that supports healthy, active aging for older adults across Northeastern Ontario. It's funded by Ontario Health Northeast, previously the Northeast LHIN, and the local public health units. The goal of Stay on Your Feet is to improve the quality of life of older adults by reducing their risk, rate, and severity of falls. We have recently pivoted away from a falls prevention focus and moved to a more holistic approach to healthy aging. So before there was about 9 points that was part of the strategy, and now it's been kind of streamlined to 3 points, 3 holistic points. So let's be active, let's be social, and let's be strong. And through Stay on Your Feet, it's a regional strategy across 5 Northeastern health units. Work is done at the local level with a coalition comprising of agencies, partners, and older adults who support healthy aging within their communities. Our coalition meets quarterly, and it includes partners in the community such as rehabilitation services, geriatric medicine, older adults in the community, long-term care and home agencies, YMCAs, etc. So let's be active. Being physically active is one of the most important things you can do to reduce the risk of falling. So tell me, what activities do you participate in to be active?
I'll let you all answer that.
Yeah, I want to hear what are you all doing?
Pickleball. We
We
walk.
all hike at least 4 days a week, many of us 7 days a week, and they are big hikes.
Hiking, pickleball?
Strength and stretch up at the village and
Strength,
yoga.
yoga. Okay, this is a great amount. I love the hiking. Actually, I've always wanted to try pickleball too.
Line dancing,
Line dancing?
Mhm.
lots of fun and great.
Do you have like a caller for that one? Like, you know, someone who says like calls the dance kind of thing, or is that
Oh, yes,
or
yes.
that's square dancing?
I have an instructor, yes.
Okay, that sounds fun.
I think keeping it fun is
Hiking.
number one for activity, is keeping it fun, interesting.
Yeah,
It
yeah.
doesn't feel like work. It just, you look forward to it.
Yeah,
Many,
yeah.
many of us bike in the summertime, at least once a week.
Very
And
good.
then we also garden for the Heritage Gardeners
Oh yeah,
once a week.
that's a workout.
Swimming.
Okay. Well, here's if you're just wondering about how much activity is recommended right now, this is the 24-hour movement guide. So staying active will help improve your flexibility, balance, and muscle strength. It's recommended that adults age 65 and older should perform moderate to vigorous aerobic physical activity for at least 150 minutes every week. So you can see that there's recommendations about limiting your time in front of a screen, sedentary behaviors, getting the 7 to 8 hours of sleep, trying to keep your wake up and bedtimes, regular. Does anybody feel like they get 150 minutes a week?
Oh, yeah.
Right on. Okay.
That's 5 days a week, 30 minutes.
We often do that in a day in the bush,
That's
especially if
right.
we get lost.
I love it. I love it.
Yeah.
Okay, so just in case someone is still like not, needs ideas about what to be, how to be active, we have this page right here. So exploring community programs is a great idea. You're obviously already kind of doing that right now. But yeah, going for a walk, kind of putting that into your daily routine. Obviously, we got great walking trails and walkways, lots of good stuff in the bush. Join a physical activity class. We do have stand-up classes, so that kind of combines the education with the exercise, and it's all related to balance and flexibility. And that's more of a 12-week program that you sign up for, but there's also free classes in the community. And YMCA is always a good one, the village. Enjoy physical activity at home. So, I mean, it doesn't have to be textbook physical activity like with a stationary bike. And, like you can be doing lots of activity at home that is good for you. So, raking leaves, doing light housework, cooking even, it's all related. Wearing proper footwear. A shoe that fits well can improve walking patterns and your balance. And if you feel like that's preventing you from doing activities, then it's worth talking to your healthcare provider about.
Mhm.
Let's be social. Maintaining social connections are key to healthy aging and overall well-being. People with strong social networks are more active and feel happier and supported. So, I mean, maybe it's related to the pickleball and the hiking, but how do you stay social? Anyone else do something else that's...
Oh, my goodness. This group is, we party too.
Party. Right on.
There's a lot of social connection in our group, I would say. Would you say that too, Jill?
Yes, yes, I would.
Yeah.
I personally play bridge 3 times a week, which is strong social and does keep your brain in gear a little bit.
Okay, okay. Does bridge have a lot of math? Just wondering.
Does bridge have a lot of what?
Mathematics?
Apparently it helps if you are mathematically inclined. That doesn't relate to me though, particularly. I have to work at it, but it
Yeah.
does keep your brain in gear for
Okay.
sure. And there's sometimes we just play games. I mean, not the bridge group, but sometimes a few of us will get together and just have a games night. Going out for lunch or dinner, going to the theater. There's all sorts of activities out there, I think, that, can be available.
Yeah, yeah. Yeah, that's good. And you go on mystery tours.
Yes.
Mystery.
And we have book club.
Oh, yes. Yeah, that's right.
Forgot about that.
You know what? I did actually scope out your website, Women 10, and I did check out the book list. And I think the next book is about a social worker. So I was like, oh, that's great. Anyways,
Yeah, we do say so. And that's, I would dare say, I put the social connection before activity, because I think when you're socially connected, the activity comes with it.
yeah.
Not just
I
my
would
own,
agree.
not just my opinion,
I would agree with you, Harriet.
Totally agree.
What can
Well,
you
we sing too. We sing
say?
sometimes.
Oh my gosh. You do everything. Participating in community activities. It sounds like everyone's kind of aware of that, but it's good that staying aware of what's coming at the Capitol Center or the free events in town, and I think that's a great way to stay social. Let's see what else. Volunteer time. Everyone's looking for volunteers. I don't know if anyone volunteers here, but lots of different organizations looking for people, and it's a great way to meet people. I did it for years before, when I was trying to build up my experience in like the social services fields. It was great, and I would still do it if I could. Connect with others through technology. So just sharing pictures, doing the video conversations, meeting someone from your family over lunch, just do a quick tea. It means so much. And if you need help with navigating some of your tech pieces, the village does have a program to help people navigate their technology devices. Joining a group physical activity class, there's a social aspect there, trying just new things. If you want to learn how to cook, learn how to cook. I just did a pottery class. I have no background in pottery whatsoever. It was completely like for beginners. It was a hand building class. Yeah, it was great. And now I have a wonky looking mug, but it's mine. And I can, continue developing my skill if I choose to. Accessing the public libraries. Tonight, I believe there's even a class on wills and powers of attorney. I don't know if it's too late to actually sign up for that, but it's good to know that there's so many classes and talks at the library. And if you have a suggestion for a topic, I'm sure that they would be willing to hear your suggestions about it as well. And libraries are just amazing. It's one of those last places where you're not expected to spend money. And I think we need more spaces like that.
Yeah.
So let's be strong. Okay, so what does staying strong mean to you? How do you stay strong?
We pole walk, not all of us, but many of us pole walk.
Pole walk, yeah. Okay.
Pole walking.
Yeah.
So you're working your whole body, when you're using your poles in the wintertime mostly.
Yeah, that's great.
If you're thinking, I'm not sure if this just is referring to physical strength, but the strength and stretch classes that are offered by the VON up at the village are great for the physical piece.
Yeah, no, That's true. And good point, Jill, because I was gonna lead into other ways that we can understand strength and being strong, actually. So thank you. Yeah.
I think it's great to think about mind, body, and spirit. So I think it's very important to reach out when you need support too. And our group is great for that, for information, support, encouragement, meditation, all of that type of thing too.
Yeah. Patty, you're so right. Like strength comes in many different ways, right? What we can do to connect with others, that's a sign of strength for sure. But also just, you know, there's these pieces as well, like managing your health, like doing the regular, you know, attending your checkups, finding fact sheets related to conditions that are affecting your life, finding support groups. These things are all ways to keep strength. And important to eat balanced meals, getting, you know, eyesights and hearing regularly checked, and that proper footwear, making sure you have that. And this is another way to keep strong, really. It's a bit of an extension, but having a checklist to go through your home is a great way to you know, find the risks before they actually become an issue. And we have these checklists, and I'll show you where to get it near the end of this presentation. Yeah, and I think they're really good too, because if you want to have a conversation with someone who, you know, a loved one, a family member, someone else that you care about their home, you can go through this checklist with them and then identify the areas that you want to work on, or you know, just a gentle suggestion. I think it's a good starting point anyways, and for ourselves as well. So this is what it looks like right here, and I'll show you where to get it in a couple of slides. So yeah, you can see it's like yes, no, you know, and you kind of tally this up, and at the end, you can see which areas of your home need a bit of work on. This is our Facebook page and our website, in case you want to stay connected with what we're doing and what events are coming up. We are trying to stay more active on our Facebook page. Right here. And this is just my social worker coming out. These are some tips for consistency and motivation. So if you're thinking this is a lot, like this is a lot to take action on, I would say start small. You can break activities into smaller pieces if you like. Some activity is better than no activity. So, you know, maybe one day you just kind of park a little bit further when you're doing a bit of shopping, if it's safe to do so. Or maybe while you're watching TV and commercials come on, you take the time to challenge yourself with your balance, 1 foot at a time. Because if you're gonna but if you're gonna have to listen to annoying commercials, might as well get some flexibility and balance out of it, something. Make a plan. If you don't schedule your time for things that are important, something else is going to schedule it for you. So, you know, making a plan can be as simple as setting a timer for something that you want to do, or also just attaching an activity to something that you already do. So if you always make coffee in the morning, maybe while your coffee's brewing, take your dog out for a walk or something, go around the block. My dog's 14, so he's really patient and he kind of walks a bit slower. So I throw in my stretches and my lunges sometimes when I'm with him, because, you know, it just kind of works for me. Bring a friend. So if you're worried about trying something new, you know, just maybe ask somebody. You know, there's a lot of good programs here. I'm sure people are you know, wanting to try things out as well. You know, at the library, there's things like park passes, provincial park passes, fishing rods, cameras, all those talks that I talked about. You know, trying to cook a meal, like I think Jill, you mentioned with somebody, maybe having a movie night with the meal. It's just something that you can do, and it really does impact your risk for falling. Okay, so this is a healthy aging page, and I would like to just show you all what we have on our page here. Okay, So I'm going to go here. Okay. Can I stop sharing just for a moment?
You may notice that, oh, you can't hear me. You may notice that Taylor has put a lot of links in chat, everybody, okay? For the home safety checklist, stay on your feet, etc.
Okay. We have that. Okay, so I'm going to share my screen again. Let's try. Could everybody see the North Bay Health Unit, North Bay Perry Sound District Health Unit webpage right now? Okay,
Yes.
thumbs up. Thank you, Jill. Okay, so you come here. So myhealthunit.ca. That's all you have to put into the search bar or Google. You go to health topics. And although Animal Bites looks cool and interesting, and so does a lot of these other ones, you want to go to healthy aging. Okay. Once you go there, you come to this page right here. And this is the stay on your feet page. So you can see our 3 points: be active, let's be social, let's be strong, are all right here. And here we will find the stand-up classes, the free community classes. And this is the 150-minute recommendation of activity right here. So these are all drop downs out of the 3 points. Let's be active, let's be social, let's be strong. So if I go to free community exercise classes, go there, kind of keep following the links that are provided there. And here we go. You can see in the different areas, we got Nipissing, West Nipissing, East Perry Sound, West Perry Sound, all these areas that have free classes. Let's say I'm in Berks Falls. And it's right there. So this is where a free class would be at 220 Center Street, Berks Falls, Wednesdays, 9:30 to 10:30. And if you want to know more, like it's a drop-in class. So if you want to know for more information, you would just call this number right here because it's put on by East Perry Sound Community Support Services. Is anyone here from Berks Falls?
I don't think so.
No, that's okay.
Can you show us what's in Nipissing?
Yes. Okay. Nipissing, North Bay. So here we got the village, which a lot of you already know about. And then also the Holy Name of Jesus Christ. So I believe this one is across from the overpass.
Yes, yeah.
So 895 Memorial Drive, 9:45 to 10:30. Put on by Vaughn.
Okay. Did anyone know about that one? That's important for people who live in the Ferris area, I would say.
Okay. Yeah.
That's what I would like to see are more community hubs.
I like hearing that. I'm in Ferris, so.
Aha. Okay. Perfect. Okay, so then and we also have the stand-up classes, but that's a bit more, you have to sign up for it and it's 12 weeks long, and these are the contacts for that. But you can find this information all on our website here. So I'm just going to go to Let's Be Social. This section right here has information on transportation, social connections. This right here is a map you can use to look up various supports in the community. You know, if you're looking for, let's say, I'll just load it really quickly. Healthcare or home care, mental health, safety, social connections. You can kind of zoom in onto North Bay, and the map will locate, you know, areas that, like, topics that you're interested in.
Press on that. I'd like to see what comes up
Okay.
for North Bay.
Let's say fitness. No, let's do. What do we want to hear? What do we want to see? Which one?
Group exercise, is it the same as it was previously?
It might be. Let me just see. Oh, sorry, we don't see.
Oh, interesting.
No, I'll put in North Bay.
That's
Here
a-
we go.
Oh, hey, I was gonna say, what? There
Okay,
you go.
we got SMART program, senior gentle exercise class, Powassan, stay on your feet. Port Loring, stay on your feet, calendar, stay on your feet. There's more results too, but yeah, so there's 6, so there's more information if you click, the more you click, there's more information right here, as you can see. So this map is pretty useful, actually, especially if you're helping a family member who's in Ontario in another little area, that might be useful.
Northeastsupport.ca.
Yeah, and it's found on our website. There's a link for it. Northeast Supports. Right there. And then, yeah, there's a bit of transportation right here. We're working on transportation though. It's
Yeah,
trying to get
that
better.
is a huge issue.
Yes.
For
And
sure.
then the Let's Be Strong right here. There's information about medication management, nutrition, and home hazards is where you will find that checklist that I talked about. The home safety checklist is right there. And you can print it off if you like. I believe that we likely have copies of it as well. Please don't hold me to that though. Taylor would know more than I do, but I think we probably have copies of this. Anyways, if you want to print it off, it's right here.
We do have copies, so if anyone would like any copies, they can just, my contact information is at the end. I can also put in the chat, but you can contact me and I can get you a copy.
Can you just drop into the public health unit and ask for that, or do you?
I would just recommend connecting with me first, and then I can
Okay.
get one either sent to you or have one down at reception.
Okay, and this is the summary at the end. You know, if you need work to be done, help needed, you can kind of, you know, arrange help too if it's something that the whole family needs to take part in. It's a good little tool.
Oh, boy, that is good.
Yeah. Okay, so I'm back to that website right here. And yeah, so there's other links all right there below. I just wanted to make sure that people kind of knew that this was on the health unit webpage, okay? Under healthy aging. So
Okay.
health topics, healthy aging, and you'll find all those links that I just showed under these 3 points. Okay.
Okay, we have 10 minutes left.
Okay.
Taylor, Leah, just so you know.
Okay, I'm gonna wrap this up actually. So just wanted to mention that we do have some working groups and we could always use some extra knowledge in these areas and lived experience of being an older adult. So we're trying to make our spaces more inclusive. So that means our community events more inclusive, transportation more inclusive, so people can attend more events and benefit from health information that we have. So if you're interested, I would get a hold of Taylor. I have her information as well. So yeah, the take-home message is falls are not normal part of aging, and falls are predictable and preventable. And stay active, stay independent, stay on your feet. And this is the contact information for Taylor because she looks after this program. This is
Her baby, eh?
this is the bulk, right, Taylor? This is your baby. Does anybody have, my last slide, I believe, is just questions. Does anybody have any questions at all? Or, you know, just, does anybody want to go back to a slide?
Can you stop share and then we can open to the gallery?
Let's do stop share.
Yeah.
Okay.
Any questions?
I had one in chat regarding the Shingrix vaccine. How often should we get the vaccine? And under this program, where would we go to get it?
Okay,
I
so
think that it, oh,
oh, sorry, Taylor, you go ahead.
I was just gonna say, I think it might be different for everyone.
Okay.
So I would just recommend to contact the health unit. You can get the vaccine at the health unit. So I put the phone number and the direct extension to the program in the chat. I can also put it in again, but I recommend with that kind of stuff to contact them and have the conversation with the public health nurse, just to make sure that I just don't want to tell you something and it may
Sure.
be different for individuals.
Okay, thanks.
On that same topic, Taylor, if we've gotten some vaccines at our doctor's office and then we show up at the health unit, do you share the information with the local, like would they have our records from our doctor's office or access to it?
Not always. So I just recommend if you have record of it from the doctors and you're coming to the health unit, if you can bring it with you so that we can put it in our files, just because it's not, unfortunately, it's not always shared.
That's too bad.
Yeah.
Let's look forward to the sharing of automated information.
And I know when the COVID vaccines were being provided regularly, they were sharing that. And that was kind of that first start of when, if you got the COVID vaccine at the health unit, it would be shared with your doctor with, as long as you provided consent that we could share it. So I think they're starting to get that sharing. But at this time, I don't believe that just regular vaccines, that information is being shared with the health unit. So I just recommend to bring that with you, and so that we can have that put on our files.
I was wondering about the how many people are showing up at the COVID and flu vaccine clinics. Is it pretty steady, or I just curious?
I think it's definitely gone down. They still offer clinics, I think, about once a week in each community. But on our website, and I can put the link, we have a dashboard that shows kind of the amount of vaccines. I haven't actually looked at it in the last couple of weeks, but we can see kind of the flows of people coming and going for vaccines for specific to COVID-19.
Okay.
I was wondering if you could elaborate a little bit more on the transportation issue. I know you just Leah touched on it, but I know it's an issue and it's something that's being worked on. But can you elaborate? Do you have any transportation policy right now, or what are your plans for the future in that regard?
So we're working with the village at Canadore College to start a working group within Nipissing Parry Sound to try to start looking at transportation. I know it's very different in each community with what's being offered, and some communities with no transportation being offered, like for example in West Nipissing. I don't think they have taxi. They don't really have a lot of transportation. So it's really, really difficult for different communities. So we're just starting that work. I was also just informed last week that there's a working group starting with, I believe the Red Cross is kind of leading it, looking at like a standardized guideline for transportation. So we're really hoping there seems to be a lot of work just starting, and we're really hoping to look at having more regular, reliable, and accessible transportation for older adults, not just for medical appointments, but for attending different social activities as well, because we see how important that is. So it's new, it's coming. We don't have a lot of work right now. We're just starting to try and get that started.
Jill?
It's Jill. I do know up at the village, and I'm not quite sure how you qualify for this, but I do know a former Living Fit member has a paid taxi at least once a week, bringing her up for, the exercise group. But I don't know quite how you qualify for that, or who actually is paying for it. She doesn't. All right. So
That's paid directly from the funding at the village. So if you're accessing any of the services up at the village at Canada College, and you need assistance with transportation, they'll get that all set up for you, but that's specific to the village.
Taylor, I would really like to see, this is a comment. My biggest concern for our membership anyways is what happens when the funding is finished at the village and we don't have access to those programs? Or is there going to be continued funding? That's number one. Number two, I think in our community, and I've identified this to a few people, is we need 5 community hubs here in north, south, east, west. And that would really alleviate a lot of the issues that are going on, especially about transportation. Because for example, for the more active people, you could bike to your exercise class, or, you know, in our area now, I know Commerce Court might be a possibility for the village, but then that might end in 2024. So I'm not quite sure what that model, and I think most of us are thinking about this because I don't want to sound unappreciative, because this has opened big doors for older adults, and I can see a change in confidence level in other people who don't belong to our organization. But I see that, and I think that's fantastic. But it would be really nice to know what the plans are in the future, and maybe the health unit's going to have something to do with that. I don't know. Can you address that? Is there anything?
Yeah, and so this is kind of the issue with these like kind of limited funding. Also with the Stay on Your Feet strategy, our funding is up as of March 2024. So we're working with Ontario Health to see whether we'll enter into another MOU with them. So you bring up a really good point. It's that sustainability, and I know specifically in North Bay, it's really hard to find reasonably priced spaces to offer classes and social activities. So I know VON with their classes, we're so grateful that we have that partnership with the village and able to offer such a great space. But I agree with you, there needs to be more programs spread out over the city so that transportation isn't as much of an issue, because I know sometimes it's hard to get up to Canada College on the hill. So I believe that Michelin, part of her work is to look at the sustainability of the program, but I can't necessarily comment on what her plan is directly, but we work very closely with her. So hopefully we can work to keep the programming running, because it's so important. There's so much programming going on at the village right now, and it's so great. But yeah, we have to think that the funding does end in October 2024 for that. So we need to think about sustainability and next steps.
Yeah, it's great. It's great that it even has taken, it's sort of like opening in a Pandora's box now, right? Because now all these people are depending on these opportunities, and we don't want to lose that. It's interesting. Does anyone feel the same way? Do you know what's going on? Bonnie, you've got your hand up.
I just actually answered part of my question. I was just wondering how the funding model is. Are you funded with an envelope of money that is specifically for exercise, that sort of thing? And then do you guys hire the VON? Is there other agencies you use other than the VON? What kind of criteria do you look at for hiring people that could do exercise? Because there are some other people, I'm sure, in the city, if there was spaces that the program could be expanded, because certainly the village seems to be becoming a big bottleneck right now.
Mm-hmm. Yeah, so the funding for the community exercise classes and falls prevention, it's through an initiative through Ontario Health. So the funding flows from Ontario Health Northeast to different community support service agencies across the Northeast. So in North Bay, that's VON, but in like East Perry Sound, so Callender to Novar, it's the East Perry Sound Community Support Services. So it's a different community support services agency in each kind of district within, but in North Bay specifically, it's VON. And then VON hires people that are trained and have experience providing exercise specific to older adults to offer the classes. And they have their specific kind of requirements within their agency to hire. So the funding goes directly to VON in North Bay.
Okay, so you guys are not a part of that funding at all?
No, so Stay on Your Feet or the health units, we just kind of support. So we support
Oh.
specifically with falls prevention programming. We support training their employees to offer the program. We support advertising and promoting the programming. We're kind of like, I get a lot of calls of people looking to register for the program, and I kind of funnel off to who the appropriate person is. So we don't directly get the funding or offer the classes, but we support through our strategy.
Okay. Any more questions? Okay,
General one, Harriet, are we walking
Sure.
today?
no,
Okay,
you may be.
okay.
Harriet, or everybody, there is a walk this afternoon at 1 o'clock with the other walkers. We're meeting at Champlain Park, where we go for the trails, but Lindsay is leading us across the Gautier Marsh because it's frozen now. So
Yeah.
across the Lavaz, we're going to do that walk at 1 o'clock.
And it's a fairly long hike, just for those who are wondering, right, John?
Yeah, it's pretty long. I have to kind of just go part way and then come back. I have to be back to the parking lot at 2:30. So I'd be happy to, come back with people if they're finding it too long.
Okay. If snow is going to continue, that's one of the main reasons that we were supposed to go to Laurentian on Chapé.
Mm-hmm.
It's unpredictable, so I don't want anyone to be driving in that kind of weather.
Okay.
That's up to you though, okay?
Yep.
All right. Okay, so I'm going to stop recording.